Hello friends, hope you all doing well. So today here in this video I will discuss about the maxillary nerve. I'll discuss about the maxillary nerve. So maxillary is the second division of the trigeminal nerve. It's the number one. Maxillary is the second division of trigeminal. It is the second division of the trigeminal nerve, and it's purely a sensory nerve. Number two, it's a sensory nerve. It's purely a sensory nerve, and it supply the upper jaws and the it supply the number one upper jaw and the gums. Number three, upper jaw and gums, and it's also supply the maxillary sinus and the nasal cavity. And the maxillary sinus and nasal cavity. Nasal cavity. So these are the supplies of the innervation. And so now the summary of supply: it supply the lower eyelid. Number one, it supply the lower eyelid, then it supply the side of the nose, then the upper lip, cheek, anterior part of the terminal, anterior part of the temporal region, upper lip, then cheek, then the anterior part of the temporal region, then all the upper jaw with the joining gums, roof of the oral cavity, then of the roof of the oral cavity, roof of oral cavity, maxillary sinus, then the anterior tooth of the nasal cavity. These are the supply of the maxillary nerve. So now the relations, course and the relations of the maxillary nerve. Actually it arises from the anterior convex part of the trigeminal ganglion, then it goes to the cranial cavity, middle cranial fossa, then it goes to the middle cranial fossa. This one is the middle cranial fossa. Then after middle cranial fossa, it goes to the pterygopalatine ganglion, pterygopalatine fossa, pterygopalatine fossa, then the orbit and the face. Then the middle cranial fossa, this is the middle cranial fossa, pterygopalatine fossa, this is pterygopalatine fossa, this is the orbit, and this is the face. Number one, it arises from the anterior convex part of the trigeminal ganglion, then it nerves leaves the middle cranial fossa, then it is the middle cranial fossa through the foramen. It's called foramen rotundum. This is the foramen rotundum. It leaves the middle cranial fossa through the foramen rotundum, and to reach the pterygopalatine fossa. This is the number two, pterygopalatine fossa. So number one, middle cranial fossa, number two, this is the pterygopalatine fossa, then the orbit and the face. Number three is orbit, and number four, that is face. Then from the foramen rotundum to reach the pterygopalatine fossa, then it transfers straight to the upper part of the fossa and enters the orbit, and then it enters into the orbit through a inferior orbital fissure. It's through the inferior orbital fissure, and then hence it's called the infraorbital nerve. Hence here it's called infraorbital nerve. Then this nerve runs forward along the floor of the oral cavity, along floor of the orbit, and in the infraorbital groove and canal, and appears on the number 4 part, that is face. Appears on the face through the infraorbital foramen. Here is the infraorbital foramen, it's open into the face. So this is the course on relations of the maxillary nerve. Now the different branches of the maxillary. Here is the different branches of the maxillary nerve, and I told you that the maxillary nerve arises from the anterior convex part of the trigeminal ganglion. This is the trigeminal ganglion. It arises from the anterior part of the trigeminal ganglion. Then the nerve leaves the middle cranial fossa through the foramen rotundum. This is the foramen rotundum. You can see here, this is the foramen rotundum. It leaves the middle cranial fossa through the foramen rotundum to reach the pterygopalatine fossa. That is the pterygopalatine fossa. To reach that, it transfers straight into the upper part. Here is the upper part. Into the upper part through the orbit, and straight in the upper part of the fossa, and enters the orbit through a fissure, that is inferior orbital fissure. This is the inferior orbital fissure. This is the inferior orbital fissure. For this name is infraorbital nerve. Then the infraorbital nerve runs forward along the floor of the orbit in the infraorbital groove and canal, and appears on the face through the infraorbital. This is the foramen. This is called infraorbital foramen. Through this foramen it appears into the face. So now the different branches and distributions of the maxillary nerve. Branches of the maxillary. Now I'll discuss about the branches of the maxillary nerve. First, the maxillary nerve gives the following branches. It gives the following branches in the different parts, like it gives different branches in the first, in the medial cranial fossa. In the medial cranial fossa, it gives a branch, that is number 1, meningeal branch. These are the meningeal branch. It gives the meningeal branch which supplies the durameter of the medial cranial fossa. Then it goes in the number B, in the middle cranial fossa. Now in the pterygopalatine fossa. In the pterygopalatine fossa, it gives the ganglionic branch. In the pterygopalatine fossa, enters the pterygopalatine fossa. This is the pterygopalatine. These are the ganglionic branch. Which supplies the ganglionic branch. There are two numbers. These are the two numbers of ganglionic branch which supplies the pterygopalatine ganglion, and this is the pterygopalatine ganglion. This area it supplies this to the area, and this is the pterygopalatine ganglion. Then the nerve gives the branches, that is zygomatic branch, zygomatic nerve. Number 2 in the zygomatic nerve. Number 3, that is zygomatic nerve. This is zygomatic nerve. This nerve is the zygomatic nerve. Now this is the zygomatic nerve, and zygomatic nerve, it enters the orbit through the inferior orbital fissure. Zygomatic nerve enter the inferior orbital fissure. This is the inferior orbital fissure. It enters the orbit through the inferior orbital fissure and divides on the lateral wall on the orbit into two branches, that is zygomaticotemporal and zygomaticofacial. This is zygomaticotemporal branch, divides into two, that is zygomaticotemporal and zygomaticofacial. So zygomatic nerve divides into two, they are zygomaticotemporal and zygomaticofacial. Then the nerve, that is posterior superior alveolar nerve. This is the posterior superior alveolar nerve, this nerve. So this is posterior superior alveolar nerve, PSN, posterior superior alveolar nerve. This is the posterior superior alveolar nerve. It enters on the one or two foramina, in the posterior surface of the body of the maxilla, and supplies the mucous membrane of the maxillary air sinuses, and the mucous membrane of the maxillary air sinuses. This is the maxillary air sinus. Maxillary air sinus, and it supplies the maxillary air sinuses. Body of the maxilla supplies the mucous membrane of the maxillary air sinus. Then it breaks up to form the superior dental plexus. This is the superior dental plexus. It breaks up into superior dental plexus, which supplies this superior dental plexus, which supplies the molar teeth and the adjoining part of the gum. This area supplies the molar teeth and the adjoining part of the gum. So now in the orbit, now let's talk the different branches on the orbit. In the orbit, it gives the different branches, which are: number 1, middle superior alveolar nerve, anterior superior alveolar nerve, middle superior and anterior superior alveolar nerve. Middle superior, and try to remember middle superior alveolar nerve and the anterior superior alveolar nerve. This is the middle superior alveolar nerve. This is the middle superior alveolar nerve, middle superior alveolar nerve, and this is the middle superior, and this is the middle superior alveolar nerve. This is the anterior superior alveolar nerve. This is the anterior superior alveolar nerve. Middle superior alveolar nerve. This is the anterior superior alveolar nerve. So in the orbit, it gives two branches. They are middle superior alveolar nerve, anterior superior alveolar nerve. So middle superior alveolar nerve passes downwards and supplies the premolar teeth, and anterior superior alveolar nerve passes downwards in the anterior wall of the maxillary sinus, through canalis sinuses, and divides into dental and nasal branches, and it's also divided into dental and nasal branches. So in the orbit, we have discussed about in the on the orbit. Now the on the face. Now let's talk about the branches on the face. So in the face it gives 3 branches. You can see here, this is the 3 branches, 1, 2 and 3. In the gives is number 1, that is palpebral, nasal and superior labial branches. Palpebral branch, nasal branch and the superior labial branch. Palpebral, nasal and superior labial. Palpebral, nasal and labial. This is the palpebral branch. This is the P for palpebral branch. This is the palpebral branch and it supplies the skin of the lower eyelid. Okay, it supplies the skin of the lower eyelid, this branch. And now the nasal branch. This is the nasal branch and it supplies the palpebral. This is the nasal branch and this supplies the side of the skin of the side of the nose and the mobile part of the nasal septum, skin of the fossa and the mobile part of the septum. And the number 3, this is the branch, that is palpebral, nasal and this is the superior labial branch. S for superior, L for labial branch. Superior labial branch, and it supplies the skin and the muscles membrane and the mucous membrane of the upper lip. It supplies the skin and the mucous membrane of the upper lip. So this branch